Greetings to all. So here we will have a small session on self-exam guide for oral cancers. This is a 2-minute do-it-yourself self-examination that could save your life. By the way, this is Charulekha and today I will be giving you this small presentation and I'm from the batch of 2019-20. The early detection and diagnosis is very much crucial for a successful treatment of any type of cancers. And today we will be majorly focusing on oral, head and neck cancers. When these cancers are detected at stages 1 and 2, the survival rate is about 80%. But however, more than half of all these cases are found in the later stages, that is the advanced stages, where the survival rates are lower, the treatments are more invasive, and the side effects of these treatments are much more significant. A head and neck self-exam is an opportunity for you to get to know your body and what's normal for you. And repeating this exam monthly will help you identify any changes that should be examined by a doctor or dentist. So here are some symptoms of oral, head and neck cancer that are listed below. So when doing a self-exam, you should be watching out for a red or white patch in your mouth, at sides such as lips, cheeks, tongue, roof of your mouth. And also you must check out for any lump or bump in your mouth, throat or neck. And if you ever notice any white or red patches, lumps or bumps, and they usually last for longer than 2 weeks or they get larger in size, then you must visit your doctor or dentist. So, to carry out the mouth test, the following will be required: a mirror, clean fingers, a good light source, and if you are ever worried, then you must ask a friend to check. At each step, you will be inspecting and feeling for any lumps, red or white patches, any changes in color or texture, lingering ulcers, or anything unusual. So let us begin with the tests. First, we come to the face. Look at the whole face. If there are any swellings that you haven't noticed before, you must inspect your skin if there is anything that has changed recently. If there have been any moles that have become larger or they have started to itch or bleed. Turn your head from side to side. This will basically stretch the skin that is present over the muscles, which will make the lumps easier to see. Neck. Run the fingers under your jaw and feel along the large muscles either side of neck using the ball of your fingers. If there are any swellings, and does everything feel the same on both sides? Lips. Using your index, middle fingers and thumb, you should be feeling the inside of your mouth. You should pull your upper lip upwards and bottom lip downwards to look inside for any sores or changes in color. Use your thumb or forefinger to feel around and inside your lips, checking for any lumps, bumps or changes in texture. When coming to the gums, use your thumb and forefinger on the inside and outside of the gum, working all your way around the gums to feel for anything unusual. Now check your cheeks. You will have to open your mouth, pull your cheeks away one side at a time with your finger to look inside. Look for any red or white patches. You can also use your fingers in the cheek to check for ulcers, lumps or redness. You will have to repeat this on the other side as well. Sometimes your tongue can be helpful to locate sore areas, ulcers or rough patches. For the tongue examination, gently pull out your tongue and look at one side first and then the other. You will have to look out for any swelling, ulcers or changes in the color. Examine the underside of your tongue as well by lifting the tip of your tongue to the roof of your mouth. For the floor of the mouth, you will have to lift your tongue up and look underneath. Then look at the floor of your mouth for any color changes that are unusual. You will have to gently press your finger along the floor of your mouth and underside your tongue to feel for any lumps, swellings or ulcers. For the roof of mouth, tilt the back of your head and open your mouth wide to check the roof of your mouth. Look inside if there are any changes in colors or if there are any ulcers present. And also you can check for changes in texture with your finger. So, Make a note of anything unusual. If you have recently had any cold or sore throat, ulcers, swollen glands, or you have bitten yourself, then these should be healing within 3 weeks. And if you have any other concerns, then you can immediately visit your dentist or doctor or any specialist. So hereby I end this presentation. So I hope you guys had a very good presentation on self-examination for oral cancer, which is very much important and significant, not just for the medical officers, but it is also very much necessary for the normal people that live, and they should also know how to examine themselves to detect any kind of differences in their oral cavity. Thank you.